Thank you. Okay, first of all, thank you so much, both of you, for agreeing for a little maggot interview here with you. I'm just absolutely grateful that Casualty have taken the maggot storyline and decided to run with it. And I just wondered what your thoughts were initially when you were told that you would be working with maggots on Casualty.
Well, they say never work with children or animals, and I was, you struggle with most co-stars in this show, but at least they had the benefit of being mute. But I think unpredictable. It was. I mean, it's an odd one. It's not. It's not a storyline you expect.
I didn't even know to begin with, and the director who was working with us on the block had said, "Oh, we've got maggots with you next episode," and I was like, I thought you meant some like hip code word for something. I was like, I didn't quite know what you mean.
We do frequently have guest characters with names like maggots.
And we were like, oh, it must be a character. No, I originally thought it was like a character's name at first, and they was like, no, you've got maggots. And then I just had this image of me like being in a vat
with maggots
covered.
And
then like, I don't know what.
I was concerned it was going to be a love story, and I suppose to a degree that's what it's turned out to be.
Yeah.
Excellent. Yes, it has. Well, we'll see that obviously as time goes on. So, what about when you actually were working with them? Was it very hard to work with them? Did they? Did you find it okay? They just sat where they were supposed to.
Well, I worked with them quite closely because I was doing a lot of collecting them from the petri dish, putting them on the wound itself for them to do their job. So I had a lot of the time they were like all over my gloves and hands, and I got pretty used to them really quickly. Excellent. I was just really fascinated by the way they move. They're kind of freaky, but in like in a fascinating way.
I have some here, if you want to have a quick look at how they move, because they are a bit crazy. But I won't make you put them in your hand.
Yeah, they are.
They are.
They're quite quick off the mark, aren't they?
They're
can turn on a
very
sixpence.
Yeah, they don't
take
know
off
what
like
they
a
don't like light, you see, so they try and escape as soon as they possibly can.
Does that imply that we're torturing them?
Yeah.
Okay. All right, poor things. Let's pop them back in their shroud.
Brilliant. Just hide them a little bit there. Okay, so what about? Did you notice any strange reactions from any of the crew or any fellow actors, or were they all okay about that?
I think on the whole they were.
Yeah.
I mean, in all seriousness, I think people will hear the word and they perceive a kind of a greater level of disgust than they actually feel.
Yeah.
But we do see a lot on this show, and the crew. I mean, there's a reasonable amount of gore.
Yeah.
And I'm not talking about the acting exclusively. And I think as a result, people do steel themselves. There would have been more reaction if somebody had to throw up or something. We see that.
Yeah. I actually found vomit a bit more gross than maggots.
I agree. I absolutely agree with you.
Yeah, it depends what situation the maggots were in as well. Like when we had them like on some meat to begin with. I think people were a bit more wary of them then. Just more like fascinating. Yeah. It's quite savage actually. I think the worst thing I saw was one of the live maggots was eating the dead maggot, and I was like, circle of life.
Are they cannibals?
Because they eat dead tissue.
Right.
They would happily eat dead tissue off each other if they were dead. They wouldn't eat them if they were alive.
That's what happened. I was being really careful with them, and sadly one that I named Steve had gone. And then
Steve the maggot.
Literally his other mate Paolo started eating him.
He's only just passed over.
I did. I was like, he's just left like 5 seconds ago. And it's so I guess it's a dog eat dog world.
Yeah.
Maggot eat maggot world.
It is. It's an absolute dog eat dog world. So one of our missions, obviously at the university, is to try and combat this negative perception, this perception that maggots are disgusting and dirty. And the maggots that we use clinically are medicinal maggots, so they are reared in really aseptic conditions and they're clinical grade and so on. Do you think that having maggots on Casualty will help at all to change the perception? And if so, why?
I think it has to a degree. I think it, one of the kind of it's an unconscious recognition, I think, from the audience that if we show something on the show, then it is relatively widely accepted, even if that comes as a surprise. And I think this would come as a surprise, but it clarifies the choice, doesn't it? Or at least as far as we can. I don't think we had a life and death case, but it does clarify the choice between discomfort, temporary visual discomfort, and actual lasting physical harm. people will react differently, won't they? But I think on the whole, it will begin to raise the question in a way that hasn't been done before.
Excellent.
Yeah, I think they'll have sort of level of fascination. That's because that's the angle that Jade has towards the maggots to begin with. So I think they're probably following her sort of journey with them a little bit. Yeah. Being like, what's the deal with maggots?
Yeah.
So.
Well, it's brilliant, absolutely brilliant. Is there anything you want to know about medicinal maggots, or what they do, or how they live, or anything about them?
What is the difference between a clinical grade maggot and an entry level, sub-recruit?
Bin living.
So basically maggots are baby flies, they're the baby version of flies, so you've got all species of flies that have maggots. The species that we use clinically, clinical grade, is only one species called the green bottle fly, which is Lucilius auricata, and it's the only one that we rear under very strict clean conditions so that it can be put onto patients without any fear of introducing any other infection that the larvae themselves might have or might carry. But we have to be careful because there are many species of maggots out there which are perhaps invasive, that will eat non-dead tissue, will eat healthy tissue. This species cannot, and that's why they're perfectly safe to use on human wounds and so on. And we also know that they produce amazing molecules in their secretions which kill bacteria, which kill fungi, which help the wound to heal. So they're clinical grade in that sense, and they're put on.
And what's the most dramatic application that they're used in at the moment?
At the moment, well, they've been flown out to Syria apparently. So they're working on wounds, traumatic wounds for soldiers and so on, out in war zones and rural areas like that. But also burns. They're used on burns wounds, which I think Casualty will portray a burns wound as well. So they are really, really prominent for chronic wounds such as diabetic foot ulcers or vascular leg ulcers and so on. And the trouble is that not only are the public a bit reluctant to say, yeah, I'll have maggots if my wound is suitable, some clinicians are as well, and a lot of nurses, because wound care is nurse-led in the UK in particular, they do have some of them do feel a little bit squeamish about it and have a bit of a problem with it. So even if the wound is suitable, they might not advocate that because there are other treatments.
It's amazing because they're only operating, forgive the slightly ornate term, in the visual realm.
Yes.
In the same way that antibiotics and other things do at a kind of microscopic level. It's the fact that one can see it happening, presumably, that causes disgust in people.
It does, although since the companies that produce them have started bagging them up, because that's really, they used to be free range, and I think Dylan might use them as free range, but
harvest the eggs.
Yeah, no.
We'll harvest the eggs. So I think the patient doesn't really have to look at them because they're put under a breathable dressing, and therefore that visual aspect isn't there. But I think it's that, as you very rightly said, it's the cultural perception that we have. It's this culture of disgust. It's something that it's innate, and I don't think I think it'll take a huge sort of cultural shift to make them, in the eyes of people, look good.
You almost need an advertising drive where you kind of publicise the green bottle as the doctor fly.
That's
what a great idea.
Because we people don't inherently like creepy crawlies. That's the problem. If you were to turn around and be like, "Hey, we're going to look at spider therapy now," I'd be like, "Absolutely no way, can't do that."
Yeah, and yet the honeybee is loved by a lot of people, and
it's a menace, as we all know. In reality,
no, but there is. Yeah, we need to save the maggot campaign as well as save the bees.
Yes,
or we just paint them. Maybe.
Some people have suggested calling them something other than maggot, but at the end of the day, they're a maggot. I don't think you can perhaps do that. But so we're working to try and change negative perception really as much as we possibly can. Because one of the things that the literature suggests is that they are saving limbs from amputation. Patients who are on the list where nothing has worked, and this is usually what we find with maggot therapy. It's a last resort. They've tried everything. A patient has had a chronic wound, it's got worse, the infection's got worse and worse, and they're scheduled now for an amputation, and then someone suggests, well, why don't we try maggots? And they will say that they save the limb because they can do that. They can eat the necrotic tissue, they can stop and destroy the infection, which we can't, and certainly with resistant species of bacteria, we're just losing that battle. We're absolutely on the cusp of this global catastrophe of mass antibiotic resistance.
I'm allergic to a lot of antibiotics, like everything. So I think if I ever, God forbid, had a nasty gash, I think, probably probably would. Well, I'm not anything else would work for me. So I guess.
Well, do you know?
I think I would. Yeah.
Yeah.
I think
That's-
Jade would, and I think Gabby
Jade would
as
and
well.
Gabriella would.
I think, yeah.
Awesome.
I'd be like, come on, give it a
what
go.
about Will? Would you, if you or your family needed maggots, then what would you?
I'd volunteer for my family for maggot therapy at the drop of a hat. Yeah, I mean, why not? Yeah, I'm not very squeamish.
Great.
So and it's kind of offbeat enough to appeal to me.
Oh, brilliant.
But you know, it does. I think it depends on the severity of the wound. It depends
Yeah.
on
Yeah.
the alternatives. But I think it suggests that one would feel the thing taking the therapy taking place in a way that you don't,
Yeah.
as I said, at a kind of sub-microscopic
Yeah.
level. So I don't know. It's quite.
Yeah.
It would be an interesting question.
Yeah, some patients don't feel it at all, and often that's because of the wound, the pathology of the wound. But some patients feel a tickling sensation, and then we have some that say it hurts, and then you can have analgesia for that. You can take a pain relief or whatever. But it works, and it works so efficiently, and within 4 days, sometimes a wound that's been stagnant and infected for a year and a half, in 4 days they'll clean it. That's the amazing power that they, the ability that they have to clean it, and that's what I suppose a lot of people don't know. And nor do they know that, not the fact that it's just very quick. It's actually, it's what's the word I'm looking for, Tom? Sorry, I've just drawn a complete blank. But yeah, no, it's very quick. It's painless. It just works very, very well, and it doesn't leave any lasting sort of problems or side effects or anything that we have.
And you make some new friends into the bargain.
Yeah, you do. You do, and people do get quite protective of them. You put them on, and they're very sort of. I'm not going to move in case the maggots don't like it, or I'm not going to walk. Especially on heel wounds, we find that patients are like, no, I've got to look after my maggots.
Yeah, when I was working with them, I was like, okay, I'm the only person touching the maggots now. I'm not the maggot rider. Here we go, naming them all. Like, yeah.
You get upset when they turn into flies and
And leave home.
Actually, that's what
Don't
do.
they? Yeah.
Leave it up.
Well, I just want to say thank you so much for this. This has been brilliant talking to
Pleasure.
both of you, and it's very good of you to do that. Thank you so much.
Thank you.
Thank you.